Thank you, Mr. Speaker. Today, Albertans face one of the most extraordinary challenges in the history of our province. The last time we saw a pandemic of this nature threaten lives and public safety in this province was with the spread of the Spanish flu in 1918. In the last days following the First World War, the Great War, which itself took the lives of, resulted in the loss of the lives of 65,000 Canadian servicemen, including over 15,000 from Alberta. And upon their return home, communities across the country and across our province were affected profoundly by the tragedy of that influenza. Today, Mr. Speaker, we face a challenge of a similar nature. And we do so, however, with decades of medical experience and expertise in managing such outbreaks. We do so with the miracle of modern medical technology and science. And we do so with the people who remain as resilient today as they were 102 years ago. Madam Speaker, I can report that as of now, we are aware of 59 cases of infection from the coronavirus here in Alberta, the novel coronavirus or COVID-19, and that we have completed some 10,200 tests. Let me commend all of those working in our health services for their remarkable efforts under trying circumstances. Let me thank in particular our Chief Medical Officer, Dr. Dina Hinshaw, who has provided thoughtful, measured advice to the government on this response. Madam Deputy Speaker, sadly, we face not only an urgent public health threat, but also, at the same time, a massive economic and social challenge. Concurrent with the coronavirus, we have seen a significant decline in global economic demand and output, resulting in what is clearly a major global economic recession. In part because of the decline in global demand for energy resulting from that downturn, we have seen a price war for energy emanating from OPEC and Russia, which has resulted in a disastrous decline in energy prices, which will affect us with great impact in this province. And in addition to these three challenges, we are still struggling, Madam Deputy Speaker, to overcome 5 years of economic fragility in this province. And so we are not as resilient in terms of our economic or fiscal capacity to respond to these multiple challenges. That is why it is incumbent upon all of us as Albertans, Madam Deputy Speaker, to come together to the greatest extent possible in unity to tackle and overcome these historic challenges that we face together. First, of course, and most urgently, is the public health imperative. And that is why we call on all Albertans to follow scrupulously the advice of Dr. Hinshaw and our medical professionals. The single most important thing that Albertans can do to prevent the further spread of this deadly virus is to respect the basic rules of personal hygiene. Madam Deputy Speaker, to wash their hands frequently with hot soapy water for at least 20 seconds, to avoid touching their faces, to avoid going into crowded areas, to practice social distancing, to avoid traveling, to do everything they can, particularly for those who are exhibiting symptoms of cold or flu, to stay at home, to self-isolate themselves for 14 days, for those who have returned from traveling abroad, also to self-isolate themselves and to closely monitor their medical condition. Madam Deputy Speaker, if people believe that they may exhibit symptoms of the COVID-19 disease, they can log on to alberta.ca/COVID to find an innovative and effective new self-assessment tool that was recently developed by Alberta Health Services and which already hundreds of thousands of Albertans have used. If after having done so, there's an indication that they may have COVID symptoms, we recommend that they call 811 to speak to a medical professional, to seek advice on how to potentially be tested for the condition. We understand that many Albertans are frustrated waiting to speak to a professional online. We ask them to be patient. The staffing of that medical helpline has been more than doubled. The number of lines have tripled, and we continue to add resources. But, Madam Speaker, let me be clear. Alberta is leading the way, as so often we do. Because of innovation by our medical professionals, AHS is delivering some 1,000 tests every day for the coronavirus. To put that in context, I understand the whole province of Ontario is conducting an equal number of daily tests for a population that's nearly 4 times our size. And we are leading, I believe, North America and are amongst one of the leading jurisdictions in the world in the per capita incidence of testing. While 2 people are in intensive care having contracted this virus, thankfully, we have not yet had any fatalities. But, Madam Deputy Speaker, let us be clear. There almost inevitably will be lives lost as a result of this virus. As we have seen in countries from China to Italy, all around the world, that is sadly inevitable. What is not inevitable is the rate of spread of this disease. And the essential challenge for all of us is to ensure that the peak point of infection does not overwhelm our healthcare system here in Alberta. We have one of the most well-resourced and robust health systems anywhere in the world. Canada's health expenditures are at the high end of the developed world, and Alberta's the largest health expenditures in the country. This legislature, upon a royal recommendation, I understand this morning, adopted an amendment to the Appropriations Act to add an additional $500 million to the Alberta healthcare budget. And so we will continue, Madam Speaker, to leave no effort on the table in combating this virus. Let me then briefly turn to the economic consequences of this. We know that tens of thousands of Albertans have had to stay home in self-isolation. Many thousands more have had to stay home for childcare or have faced recent layoffs. And we are working urgently with the Government of Canada and the other provincial and territorial governments to ensure that there is adequate income support for them and for those individuals so they do not have to choose between following medical advice to self-isolate and being able to take care of their families' financial needs. We call upon the business community, including the banks, to exercise understanding and flexibility during a time when many people will be stressed to pay their mortgages, their rent, and their basic bills. We call upon unions as well to demonstrate the same flexibility with respect to union dues. They too can have a role to play to provide support to their members. We salute the wonderful charities and nonprofits in Alberta and civil society that will be providing support to those who are facing isolation. And this government is working on an unprecedented economic and fiscal rescue package to provide greater liquidity to both businesses and households who are facing enormous financial stress and to create economic stimulus so that we can turn the corner and recover from the massive economic threat that is posed to Alberta today. Madam Speaker, let me close by saying, once again, that as we were in 1918, we are still a resilient people, a people of great innovation, of hope, and of optimism. And while we are facing challenging times, we will get through them together.
Here, here.